thank you so much for taking the time to make a video with me and answer some questions.
My pleasure.
Give me a little bit of information about you, what you do, your field of pharmacy, and your typical day, I guess you could say.
Well, I am an assistant professor in the College of Osteopathic Medicine in the Integrative Medicine Department, and I also have a clinic here. It's called a Functional Nutrition and Herbal Therapy Clinic in the NSU Pharmacy, working under a great pharmacist, yourself, being the director of that clinic pharmacy. So anyway, and I really love it. I get to see patients. We've got 5 courses for professionals, healthcare professionals. We've got pharmacists and physicians working together. It meets once a week. It's called Functional Nutrition and Herbal Therapies course. It's 15 graduate at master's level credits. It can be taken as a certificate by itself, or it can be taken within a master's in nutrition program that we have at the College of Medicine.
And what's your typical day like?
Well, the days I'm seeing my patients, so a patient will call the pharmacy, they make an appointment to see me. They come in and, or we also send the paper out, work out first. They fill in about half an hour worth of paperwork because there's a 200 question survey, and that survey is based on what we learned in physiology. It looks at the parasympathetic, the sympathetic nervous system. It looks at cardiovascular health, liver, endocrine systems, all of those types of things. And then when a patient comes in here, the visit lasts about an hour and a half. I'll ask them all sorts of different things, from what they eat, how many times they defecate a day, what that might look like. Ask about their hormonal issues, when they started puberty or went through menopause or andropause, all sorts of different questions about their nervous system. And then I'm also happen to be a naturopathic doctor, and I learned a lot of very simple naturopathic tests. So one of the things is iridology. We can look at people's eyes, we can look at their fingernails. The Chinese do tongue analysis, so I do all those, incorporate all of that in. So it takes about an hour and a half, the visit.
Where would you like to see pharmacy in, let's say, 10, 20 years from now?
I think pharmacists, we have been so trained, and I was a biochemistry major in college, and my physiology professor actually flunked a third of my class out because she really made us think of how logical the body was. So she would ask you a question on the exam. I remember this question is, if you had Addison's, which is low or no cortisol and hormones coming out of your adrenal gland, what would happen to the QRS wave in the heart? So this type of thinking is really functional, what functional medicine and functional nutrition is. And I get 2 types of patients. Actually, I get 3 types of patients. The first type of patient I get doesn't believe in medication and wants to stay away from contemporary drugs and doctors. Now, I don't believe in that myself, but these people also need help. So I'll help them, and because when I help them in a natural way, a good example, I had a patient, her son had Crohn's, and I put him on a diet and some herbs, and he was refusing to change his diet, so he was put in the hospital for bleeding. So I had to explain to her, he needs Humira. We can't take the risk of him bleeding out, and while he's on that, let's help him more understand the necessity to change the diet. And all the research, with Crohn's is pointing to the microbial, and there's natural antimicrobials and things like that. So there's many things that don't interact with the medications whatsoever, and it can't hurt to take them. And they offer, if nothing else, the herbs also have many nutrients. Some are higher in B vitamins, some are higher in calcium or whatever. So let's do no harm. See how we can help the patients in that way. The second group of patients I have been to 5 physicians, And also, I get many doctors from here and also University of Miami sending me patients. Like, they don't know what to do, and we work together very nicely. Like, we're working with the rheumatologist here. We work with the neuroimmune clinic, one of the most famous doctors in the world, Dr. Nancy Klimas. So we work with many different kinds of physicians here at the university, and we work very nicely together. So it's a really nice collaboration, which it should be. I'm not trying to be a medical doctor. I'm trying to help the doctors any way I can. And also, a lot of physicians also send patients, they want me to help them get patients off the medication, and they don't really know how to do it. So working together, sometimes I might ask them to make a compounded the medication in a compounded way so we can gently take the patient off from that. Working together is, I think, an amazing opportunity. Any way we do, whether it's MTM or pharmacists working in nutrition in a patient's office. I know pharmacists work as nutritionists in endocrinologist's office. So there's so many different things we can be doing, and it's cool because I really think that the pharmacists, it's our place to be the phytochemistry expert, the pharmacology, the pharmacognosy expert. I mean, really, we have the most background to know how herbal medicine can work. And so I'm really committed, as you know, for pharmacists to learn this and to be able to help patients, because I get so many patients that are looking for something like this. I never even advertise, and I get a lot of patients. So even if someone advertised, they get more patients.